Our topic today is cerebral palsy, and we're talking with neonatologist Dr. Bair about ways of assessing the developmental abilities of children. Dr. Bair, tell us about the Developmental Assessment Clinic. What is that? What do you do there?
Okay. Well, the Developmental Assessment Clinic is basically an obligation, if you will, of level 3 NICUs. And
NICU, translate.
Into neonatal intensive care unit.
Thank you.
When you're a level 3, you're taking care of the highest risk population. And each unit has to decide what they identify as the highest risk patients that they're going to follow up on an outpatient basis. Now, some places will have clinical follow-up clinics where they're actually managing medical problems. Ours is a developmental assessment clinic. So we're assessing the development. So this would be mostly neurological, but the development of the child after they've been discharged from the NICU. Now, typically, we want to see those kids. We love seeing cute, cuddly kids, but we want to see them actually at a point in their development where they should actually start to do something. Now, if we were to follow these kids up on their due date or expected due date or at 40 weeks, and some of those kids are extremely preterm infants that may go home when they're 3 months old, well, we have to correct for that. Because neurodevelopment...
Adjust your expectations.
Correct.
Of that child.
We adjust it for the first 2 years of life. And we adjust that because at 3 months, they weren't necessarily supposed to be born yet, or they were just going to be born. So if we followed them at say 4 months after they were born, they'd only truly be, against their peers, a 1 month old. Well, what's a 1 month old supposed to do? They're supposed to lay there and look cute and cuddly, and that's about it. So we want to see them when they're actually supposed to actually be doing something. So we see them first when they're 4 months, and then we typically will follow them as needed in 4 month intervals thereafter.
And what are you doing? What are you telling the parents?
Well, the assessment clinic, again, every NICU is allowed to do it differently. There is no set standard. We use a developmental approach that involves a multidisciplinary team. So we have speech and language pathologists, we have occupational therapists, or a physical therapist, and then the neonatologist. So they're first assessed by a nurse who gets their complete history since discharge from the NICU, and we get a general feel at that point how the child's eating, sleeping, has the child been readmitted to the hospital, if so, what medications are they on, and who's following this child directly beyond their primary care provider. That gives us an idea of what services are already in the home, and we also ask, are they being seen, such as programs like Early On, which would be for that can assess and deal with issues in the first 3 years of life. After we've done that, then we bring it in. It's a little intimidating, probably more for the parents than it is for the child, and we bring them into one room and we do a group assessment. And the parents get immediate feedback right there on the spot of what we're thinking or what we're concerned about.
It must be very valuable to those parents.
It can be. Yes, and most of our feedback from parents is they do find it a very valuable service. Now, the point to stress here is this is an assessment clinic. It is not a treatment clinic. So we identify weaknesses, if you will, no pun in turn on that word.
But some of them are literal weaknesses.
True, some truly have weaknesses or deficits. Many of them, most of our kids are actually doing quite well. Now, if we identify something where the child may be just lagging a little bit behind, say at 4 months, example, one of the things that we would be looking at is tone, specifically looking for things like cerebral palsy. So early on, we're looking for evidence of decreased tone or evidence of weakness in that child.
This is
muscle tone,
weakness. Exactly.
And a pull to sit would be a good example. A pull to sit is where you gently hold the child by the hands. And at 4 months, if you're pulling up with the hands from a reclined position, that child should start to flex their arms and pull with you and pull the head forward just a little bit such that the child's pulling up. What we don't want to see would be the child who, as you're pulling up on their hands, their arms are extended and their head is falling off the back of their shoulders. That would be a sign of decreased tone. We're also looking at, is the child able to hold the head up? At 4 months, is the child showing the beginnings of the ability to roll front to back, back to front? And then we're looking at things like shoulder strength and the ability to begin to bear weight. All those things bear weight, if no pun intended, again, on whether or not the child has appropriate tone or not. With respect to cerebral palsy, as we talked previously, one of the issues is tone. And tone is different than strength. It's whether or not are you flaccid or are you increased and rigid? Those would be the extremes on either side. So we're looking for those to see whether or not a child needs additional support, either it be in the home or in a clinic setting where the child will be working with an occupational therapist, physical therapist. And as the kids get older in the clinic, then we're watching more specifically for the sounds that they're making to see if they need speech and language intervention.
Dr. Bair, I want to thank you so much for the education you've given us about this, and we're going to take a short break now, and when we come back we're going to learn more of value to our viewers about what they can do if they find out that their child has cerebral palsy. So I want to thank you so much for being with us today on Champions of Care.
My pleasure, Mary.
And I hope you'll stay with us. We'll be back in just a minute.
So, what's it gonna be? We could ride bikes, skating, movies, zoo, whatever you guys want to do.
Can we just do this?
Yeah. We could just do this.
The smallest moments can have the biggest impact on a child's life. Take time to be a dad today.